Hello, everyone. I'm Dr. RAMA PATIL, consultant neurologist from Dr. R.M. Patil's Suraj Hospital, Sanpada, Navi Mumbai. Today, I will be talking about quality of life issues in epilepsy. Epilepsy can be associated with profound physical, psychological, and social consequences, and its impact on person's quality of life can be greater than that of some other chronic conditions. A number of factors are thought to contribute to this, including the unpredictability of seizures as well as the stigma often associated with epilepsy. Importantly, no two people with epilepsy are the same. Seizure severity and frequency varies greatly from person to person. Research suggests that increased seizure severity can have a negative impact on person's quality of life, contributing to anxiety and socially avoidant behavior. So, the impact of epilepsy on quality of life can be substantial with far reaching and lifelong consequences. There is now growing recognition that when assessing the impact of epilepsy, patients and physicians should look beyond counting the seizures. Key areas of quality of life influenced include education. Often, children with epilepsy receive inadequate schooling. Children of average or above average intelligence who were living with epilepsy had at least a 2 year deficit in reading skills. This significantly lower educational performance could be attributed to cognitive impairment, which is caused by the etiology of epilepsy itself, the frequency of seizure activity, and effects of anti epileptic drugs. Cognitive impairment can take various forms, but the most common are memory impairment, mental slowing, and attention deficits. Unemployment levels are disproportionately high for people with epilepsy, approximately 2 to 3 times greater than general population and higher than seen in people with other disabilities. People are more likely to experience problems in identifying a job than, than the general population. This combination of institutional and social restrictions often results in people with epilepsy underperforming at the workplace. Third thing is independence. Many people with epilepsy experience problem with physical disability, which may limit the independence. The fear of having a seizure, cognitive consequences of epilepsy and treatment, and ineffective treatment also hinders the independence. An inability to obtain or retain a driver's license due to uncontrolled or breakthrough seizures adds to limitations and restrictions experienced by people with epilepsy. Driving is a key issue that can have a detrimental effect on the lives of people with epilepsy. Effective seizure control can help them to drive, increasing their level of independence and ultimately improves the quality of life. Another important thing is social isolation. Many people with epilepsy hide their condition from others, which can result in social isolation and reduced self esteem. It can also lead to feeling of helplessness and depression. Together with the social stigma that persists in some parts of society, people with epilepsy often feel a sense of social isolation and have overall reduced quality of life. This is true not just for the patient but also the caregivers. So very important to understand that the quality of life is affected not just for the patient but also for the caretakers. So the important message I would like to give through this is that adequate seizure control with effective treatment can help to a great extent to improve the education, level of independence, employment, and it can improve social freedom for such patients. Thank you.